Good afternoon, everyone. It's Dr. Gershon with another BetterHealth webinar. I am absolutely thrilled to be here with an incredible woman, CEO, entrepreneur, founder, and leader whose heartfelt mission really is to address an incredible problem in our society. That is the abuse of children, the fractures that they unfortunately sustain. And she has found a very elegant solution. She will tell you the story from her own perspective, but she's a brilliant engineer, a terrific CEO, and she's here today to talk about something that I think really is game changing, using incredible technology to solve real world problems for people. There are second and third kind of use cases for the product as well. Certainly, it is an incredible technology that she will tell you about, which has other implications for athletes and other people because of the technology that provides really a platform for different use cases. First, before introducing you to Deanna Hall, I want to just say once again, thank you so much, for all of your support. Um, it's just been an outpouring over the past 6 months of emails and texts and messages from people who are excited about this community that we're building. These webinars are really about bringing people together and telling the stories about incredible CEO, entrepreneur, founders who are heartfelt, mission driven, have vision, and who fight odds to create things that improve our health and well being. From large companies to small companies, from cloud providers to biopharma companies to med tech engineers to physicians, it's a community that is building and building and building. And so we're thrilled to thank everyone for coming today to take part in that. We have people from all over the world, and I urge you, when you sign in, please, if you have a question, put your email in. We will get back to you. If you're signing in, tell us where you're signing in from because it is an international audience. With that being said, I want to jump right into introducing you to this absolutely fantastic person, Deanna Hall, who's the CEO of ActivArmor, a company that was established several years ago that is mission driven. And she will tell you a bit about her personal story. So, Deanna, please welcome. It's a pleasure to talk with you. We've had many opportunities to discuss your incredible company, and now is a chance for you to share your vision and your heartfelt, authentic ideas about how we can improve healthcare for so many people, particularly children.
Absolutely. Thank you so much for having me. It's been an exciting journey. Like you said, I'm a chemical engineer. I went to Colorado School of Mines, and then I worked in Fortune 500 companies all over the country in engineering and software. And it wasn't until I took some time off when my daughter was young and started running a mentoring program for children in poverty that it kind of all came together at what the mission of this company is for and what I was meant to do. And so when I was running this mentoring program, the children would often have domestic violence, substandard living conditions, and they would often have these casts on that were made of fiberglass that would get just filthy. The kids couldn't even practice basic hygiene, like washing their hands to have a snack. And I thought, man, this technology is archaic. Why are we still using this? One little girl was sleeping on her grandparents' floor and ended up with bed bugs underneath her cast. One little boy was in first grade and being raised by elderly disabled grandparents, and he couldn't keep his arm in a bag outside the shower by himself, so he got it wet, and he didn't want to get in trouble, so he didn't tell, and they didn't have transportation to go and get it replaced anyway, so he wore it like that for 3 weeks and ended up with permanent scarring on his arm. So knowing that there was technology to provide a better alternative, I made him a little cast out of 3D printed plastic that is biocompatible, so the same plastic as Legos. And I said, take this to your doctor and ask him if you can wear this instead. And the doctor called me and said, do you think you can make me some more of these? And that was in 2014. And now we are a global company. We have 11 other countries that are using the product, and people are finding that they really want a sanitizable option for fracture care and to just be able to practice basic hygiene like swimming, bathing, and showering.
Fantastic. I want to I want to focus a little bit about children who are abused, because clearly this is something that is a very emotional and difficult subject. It is it is certainly a devastating truth that um, you know unprotected children suffer in this country and in others, and the healing process, which does require care and supervision and follow through from physicians, um, is certainly not part of the abusive environment that many of these children suffer. So I would like you to speak a little bit about that, because for me that really, you know that is just pulling on my heartstrings, to be able to see children who can get out, can do things, can be athletic. We have a couple of pictures which we can actually put on the screen here when you talk about this, which I think represents, the beauty of children is their spirit, and abused children suffer so much psychological trauma. Um, Moving them into the water, into the outdoors, allowing them the freedom of movement, and with something that's light, that's you know allowing them to live a normal day. I'd like you to speak to that.
Sure. And yeah, and we are so blessed here in the US to have access to clean water and, basic hygiene, but, some don't, some still don't. And so all over the world, but also here in the US, it's also about transportation and isolation. Sometimes these communities and these kids are isolated from the resources that may be available in the community, even here in the US. So in this specific mentoring program that I developed here in my hometown, the area that these kids live in is isolated because they are flanked by highways on all three sides. So it's like a area where they can't access a lot of the resources. And if they don't have transportation, then that's also a problem for the kids to have even the library, the school system, the, bus routes, and, access to doctors and, the Medicare and the Medicaid and those providers. And so it is hard for them to even access the resources that are available to them.
Yeah, I mean, one of the things that I think is important is the disparity that is embedded in the North American healthcare system, more in the U.S. than in Canada, but certainly in both, and certainly throughout the world. So, disenfranchised communities, which include children, are overlooked in many ways, and I think as a physician, this is a tremendous unmet need. I know that I spoke to a number of different orthopedists, as you have, and we're going to talk a little bit about their feeling, their feedback. I think real world feedback from people who are dealing with fractures every single day is something that I want to focus on. And then I want to talk a little bit about the technology, because you're an incredible leader, you're a visionary. I know that this technology comes out of your background as an engineer, but I also want to talk about your experiences as a woman leader, as a woman leader engineer. Like what was that like? So you have this amazing idea. Tell us about that journey, and tell us about how you're interacting with physicians and giving you feedback, and investors who are giving you feedback.
Right. And it's been such a dichotomy between how it was in school when you're all kind of in the same boat, you're all learning the same math, science, engineering basics, and then you come out into the real world and the corporate environment. And when I was in engineering, and this is, I'm going to date myself, but it was way back in, as my daughter puts it, the 1900s in 1997. And when it was 1997, and when I started in the engineering world, I ended up deciding that I really wanted to go more high tech and into software, because it was still very old school. They're doing calculations on the back of an envelope. And when they found out I could do 3D CAD, they stuck me doing CAD work, or faxing things, or whatever. And so it was still kind of that old school mentality, even with investors. I mean, I've had a pitch to an investor where they told me, if you had a male founder, I would consider investing, but I'm not going to. So it hasn't been all like that. In fact, in a lot of ways, it's been very encouraging for me as a woman to see people coming forward and focusing their investment on women-owned businesses and minority-owned businesses, and really wanting to help support folks like that. But it is true that we get single-digit percentage of the venture capital investment still, and so I'm hoping that with companies like mine, we can kind of change the perception of women-owned businesses as maybe kind of smaller scale, but to see something that could be an actual game changer in the industry, such as a digital solution for casting, just like ActivArmor is. So I'm excited about the future and where things are going, and especially with products like this, where as a woman, I feel like we have almost a better vision for the need for with children and with families, and with maybe a nurse who can't practice basic hygiene, so she's out of her job, and also being a mom and can't change her baby's diaper, or do the dishes or anything like that, even in the original roles, but also her new roles where she's a physician and she needs to sanitize her hands to practice surgery. So all of those, through our varied lives as women, all the things that we have to do at work and in the home and all those things, we really need the versatility of products that will allow you to do things like practice hygiene, like sanitize your hands for our active lifestyles. And so that's why this product was developed, is to help those who really just need access to the basic hygiene, like sanitizing their hands or taking a shower or whatever. And that works for athletes. It works for, people with substandard living conditions. It works for active people who are in jobs that may be in food handling or healthcare, where they need to be clean and safe. And that this is a great product for all of those population.
Let's talk a little bit about the technology, because obviously this is a mission-driven company, but let's talk about the technology, and let's talk about how physicians are intersecting with the customizability of this technology, the lightweight quality of the technology, the ability to make another mold at an instant if something happens. Talk to me a little bit about I wouldn't say the economics, but I would say kind of the practical or functional aspects of customizing something, perhaps having to redo it, how our physicians, who are not really very often keen on change, how are they looking at this? I know you have relationships now with a number of different, well-to-do medical centers, and we could talk a little bit about that feedback.
Yeah, absolutely. And this is a digital process that's replacing an traditionally analog process. So the process where you take some material, fabric out of a drawer, and you wrap it on a limb, and then you wait and you wet it and you wait till it hardens, and then you saw it off and reapply it. That's the original method, and that's been the same method, whether it's plaster or fiberglass, for hundreds of years, right? So to change that process to a digital one, where you take an iPhone and you do a digital scan of the patient in any position that they want, any body part that they want. You can draw right onto them where you want the exact cut lines to be. If you want an offset for pins or incisions, if you want a hole for a bone stimulator, muscle stim, TENS units, biomonitors, whatever you want. If you want it thin, breathable, lightweight, and removable like a splint, or if you want it thick, protected, locked on like a cast for patient compliance, especially with pediatrics. If you want it to be offloaded for a diabetic ulcer on the bottom of their foot to make sure that they can have, that they can walk and it can offload that area to reduce pressure on those ulcers. So it's an unlimited number of design options that you have with a digital process where you do a scan and then you do a digital design and then you fabricate. And 3D printing has made mass manufacturing of custom devices able to become the standard of care. And so that's where we're moving with additive manufacturing and 3D printing is mass customization, is you can print them on site. And this one that you see on me is a 2.5 hour print. So it's not as quick as grabbing some fiberglass and putting it on you, but it can be while the patient waits. And if not, it's a quick turnaround time. And a lot of times when patients come in, they're going to have edema, they're going to have swelling, and they're going to need a trauma splint, which we also have that's washable, waterproof, breathable. And I think the key, if we've learned anything through the pandemic, is that we need to reduce our viral transmission rates. We need to reduce our complication rates post-surgically. And part of the way to do that is practicing good hygiene and sanitation. So we want to make sure that we have products that enable that in the hospital system. And so as the only sanitizable cast on the market, I do feel that this will become the standard of care. And while we are early to the market, some, providers say, hey, I want to see it work for a couple of years. And that's totally understandable. But this, I feel, will be the future. And for the providers that are using it, they are making it the standard of care for their patients to reduce their complication rates themselves and their costs, right? As well as because they're not having to saw off and reapply casts over and over with a lot of medical waste. And these are all recyclable too. So we also want to think about the environment. We want to think about the future for our kids, not just while they're wearing it, but also in the future with medical waste and biodegradable plastics and all of those things. So those are all important in the thought process with the providers, with the hospitals, and with the patients.
That's great. Now, talk to me a little bit about, I'm a scientist, I'm a physician, I like data. Mm-hmm. You have a lot of studies that you've done.
Yes. Mm-hmm.
Talk about some of those studies. Like what are some of the primary endpoints? What are the things that you're looking for? What is the data that you've gathered? And, what's the take-home message?
Right. So there are healing outcomes for fracture care, which is one of them. Like, do these immobilize as well or better than the traditional methods of a cast, right? So the way that we check that is by malunions, right? Like, how did any displace? The cool thing about ActivArmor is you can visually see and treat the skin while they're immobilized, and you can adjust it. So you can bivalve for swelling. So if they have edema come up, you can immediately see that and bivalve it. So you're eliminating the risk of compartment syndrome. If they have swelling that has gone down and there's movement underneath, you can't see that in a traditional cast. You can only see at the top of the hand and down here. You have no idea what's going on under there. So with these, you can adjust it and tighten it up where you need to make sure that the immobilization is consistent through the healing phases with their changes in edema. That reduces the risk of malunions and makes sure that the healing outcomes are better. And there's the complication rates like infection, right? If you have an incision underneath the cast, you're covering it with fabric that traps moisture and bacteria against your skin. And you don't know if there's an infection there until it's run all the way up their arm or down into their hand. With ActivArmor, you can visually see, treat the skin, you can put topicals on, you can expose it, you can offset it for comfort. Those are all things, and it doesn't trap moisture and bacteria against it because this is just biocompatible smooth plastic against your skin. So water just drains out. You can shower and rinse out all of the dirt or anything that gets trapped under there. Your skin doesn't slough off, and that you have to wear that and it smells bad, and it, all of those issues and that skin maceration that happen over weeks or even months of wearing a cast don't happen with this. So those are some of them, not to mention patient compliance, right? even with carpal tunnel and elderly patients, they're normally taking their carpal tunnel or their braces off that improve their pain when they have to do the dishes or do the gardening or any of their basic lifestyle, or take a shower, any of those things that they do in their daily lives. With these, they can keep them on through all of those things, and that reduces their pain, which then reduces their opioid use. So it's a positive cycle, and those are some of the things that we're testing for and proving in our clinical tests.
So let's dial down a little bit deeper. Let's just pick one or two of these clinical trials that you are part of. Give us an example of what's something that you're doing looks like or have done. What does that look like? Who are you working with? What are the types of patients? What are the medical centers? Certainly for the ones that have been finished, we can talk more freely than the ones that are ongoing. Give us a
Right.
sense, because I know that there's quite a lot of information that you have. So give us a finer look at that if you can.
Sure. So we have done research studies with podiatry schools, which I think are the most exciting that I've seen, because they are for Charcot foot or diabetic foot, where as you probably know, they have neuropathy and they lose feeling in the limb, and sometimes they have to have amputations of toes or part of the foot. They get these ulcers that form on there that when they walk on them, it exacerbates that problem, and they have these wounds that don't heal. And it's very important for folks who have these kind of medical conditions to be able to have mobility, like getting in and out of the shower, and being able to walk and have offloading on the areas that are affected. And a lot of them have either amputations or deformities that need to be fit with a custom boot. It's not one size fits all, especially for folks that have problems like that. And so when we're able to customize the design specifically for the patient and put them in something where they can use topicals, antimicrobial, antibacterial topicals, and things like nerve stimulators, right, to help increase the blood flow through their limbs. And we have research studies proving that we can reduce amputation rates and mortality rates in folks with diabetes and Charcot foot by using custom offloading boots, especially in sanitizable materials like this.
I see. And in terms of these studies, can you give us a sense of what some of the medical centers are that you've been working with?
Yes. So we were working with Northwestern University School of Podiatry, and some other podiatrists, small clinics. You can see some of them listed on our website. And there's also published research on our website. You can see some of the studies that we've done, bacterial load studies, et cetera, where you can see, they were taking data, swabs, with the traditional methods, and then with ActivArmor comparing them side to side, side by side, and then the healing outcomes and the complication rates, right? And you will see published research. There was one research abstract that was submitted by Cedars-Sinai hand surgeons, for example, on reduction of complication rates. And you can see all of that published research there. And we're constantly publishing more. And because it's really an open area where there hasn't been this option to be able to test with before. So the number of research studies, like you'll see one there that was published at American College of Sports Medicine annual conference on microporosity and 3D printed medical device wearables, right? Because you want to make sure that you are checking to see if there's any porosity that's so small that could trap moisture and bacteria against your skin. People think that, you can just 3D print whatever you want in your garage and then wear it, but you can't. You have to be very careful about biocompatibility and microporosity and all of the things that make medical devices safe and effective to use, and then make sure that you're doing that in a smart way. And that's one of the reasons that we publish this research, is to make sure that people feel comfortable with the new technology, since we are asking them to change from a system that they've been using for hundreds of years to a new digital system.
Great. Now I'm going to put my investor hat on for a second, because at the core of Endeavor, we're now in our second fund, but the fund is fed by our venture studio. The venture studio is a roll up the sleeves, day by day, week by week, kind of grinded out relationship with early stage companies for 4 years. We typically work with pre-seed and seed or Series A companies, and we build them really to juggernauts to be able to invest in our Series B venture fund, Endeavor 2, with our syndicate partners. As part of this process, we focus in on building out everything from corporate governance to bespoke go-to-market strategies. And within this system, of course, we're aware of competition. So I would like you to talk a little bit about competition. This is, a new technology, but it has been around for a while. It is a technology that you have one particular use case. So there are many. I look at this as a platform technology, but I want to understand from your perspective in a transparent way, who else is working on this type of technology in orthopedics, and what distinguishes your company from the competition?
Sure. So here in the US, not a lot of people have been investing in it of late. Now, there have been some international companies, but they don't have much traction, even in their own countries, let alone here. I think part of the problem, or part of the reason for that, is because it is going to be a culture change within the hospital systems and the providers in these. And that takes some time. And so we have competition in the kind of materials side, not so much in the mass customization side. So in other words, in materials, you'll see sleeves that have holes in them that you can slide on and then in some way cure the resin, either with a UV light or by, two-part epoxy mix or whatever. The problem with products like that is you get things like window edema, right? Because they're not adjustable. You can't have something that locks on for an acute injury and not have it be very adjustable for swelling, because changes in swelling will come up and down. And that's even more dangerous than just putting them in something that has compression. So you want to be very careful about using breathable, like a sleeve. And there is no one size fits all either. So when you're using a sleeve, you get, and that's part of the problem with some of the other competition where, it's waterproof splints, right? Where they come in extra large through extra small in left and right in 12 different designs. And you have to have all of that inventory in your closet waiting to fit one patient, where then you can heat it, and mold it to you. So a product like that. And then if you have to remove it and dry it out on the inside because it has some sort of fabric and then put it back on, that's an issue for compliance with fracture care. You're risking displacement. So that's not really waterproof, right? And if you do have anything that's removable, now you have an issue with patient compliance, right? Because especially in pediatrics, they can take it off. So the things that this product fixes are specific to fracture care and, Charcot foot, diabetic foot, things like that. We listen to our customers, I think, more so than a lot of the other technology companies who are just showing what the science can do. They can make a thin, lightweight, breathable little spider webby design, which may work to immobilize, but it's not protective for fracture care. And doctors want you to have an airbag on your arm. And we listen to that, we hear that. And so they'll say, oh, well, you got a big bubble design. I'm like, yep, that we know what our customer is the provider, and the provider wants it to be protective. So that's what we're going to give them. And so we have worked with the technology on the scanning side, the design side, for the top orthopedic surgeons and sports medicine doctors across the country for 8 years, developing these designs that are specifically tested and proven to work for fracture care in that space. And then that's what we bring to market. And so there is the end consumer, the end user who wants what they want, of course, but our customer is the provider. And so those 400 hospitals and clinics that have sim centers and innovation labs and already have 3D printers on site, those are our first beachhead market, right? Because
Right.
those hospital networks are investing in products like this, technologies like this, to improve patient healing outcomes and also the quality of life for their patients while they're healing, as well as reduce their complication rates and infection rates and viral transmission.
Fantastic. So now let's talk about a little bit about crystal ball in the future. It 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 is compelling about the things that you talk about being a CEO, about being a woman entrepreneur and founder, about the vision. Um, there's different kind of cohorts from children to athletes to uh, patients with chronic diseases like diabetes.
Mm-hmm.
But let's talk about the future because, one of the reasons that I'm excited about being a physician and an investor right now is I've never seen an, an incredibly robust intersection like I'm seeing now between science, medicine, technology, and liquidity. There's a massive amount of money that's being thrown into healthcare investment. And Endeavor and our venture studio is focused in on positioning ourselves in between high demand and high liquidity. So
Mm-hmm.
I want to talk a little bit about what you see kind of going forward. As your product becomes more and more understood, and physicians who tend to be slow to change become more comfortable. Where do you see this as kind of next generation in your field of vision?
Yeah, absolutely. I mean, as you know, with the industry, you either don't have a good solution or you get wiped out by a competitor or you get bought, right? And our whole goal with the entire company has been to be in that third category. And so we've been speaking with our potential acquirers. And as you know, like a lot of these big companies in, medical devices have not been investing in R&D because we've all been going through COVID and we've all been, focusing on mergers and acquisitions and those kind of things. And so these big companies have not necessarily been investing in these new technologies. They're like these big freighter boats that are watching these little speedboats go by, and they're going to lasso a few of them and let them pull them. And so that's what we are. We are one of these little speedboats that's going to go by, and we are positioning ourselves specifically to be acquired so that we can scale and make this a standard of care. So we're focusing on market penetration and adoption in by those innovators with that beachhead market that I discussed. And then that is our goal. We're positioning the company for sale. And we've already been talking to these potential acquirers. We have conversations with them all the time about specifically what are you looking for, what number of sales, what strategic targets. And that's exactly what we're doing. We're laser focused on our end goal.
So one of the things that I look at, is big kind of macro shifts. And one of the shifts is hospital to home.
Mm-hmm.
Hospital to home has tremendous economic benefit. It has psychological benefit. Everything from diagnostics to kind of curative therapies, from biosensors to um, potentially products like yours, where
Mm-hmm.
there can be an intersection between a device and a sensor. So do
Yeah.
you see anything, in the future where your product might have some biometrics that are attached to it?
Absolutely. So, not only for improving healing outcomes, like a bone stimulator that'll let you heal in less time, or a muscle stimulator that'll reduce your rehab time, or a nerve stimulator that, or even a TENS unit, right, to help reduce pain so that you don't have to take opioids or whatever, but also biomonitors, right? So, monitoring fracture healing, monitoring even your vital signs, your blood pressure, and all those things. There are even adaptive products that you can put into the cast that will predict a fall for an elderly patient before it even happens. And so those kind of things. The cool thing about custom design is these are all completely adaptable to any of those new technologies and advanced healing outcomes. And we definitely see that as being the future of medicine, just like you were saying.
Yeah. And
Mm-hmm.
then the last thing, of course, no program um, on BetterHealth would be complete without a mention of AI, machine learning, deep tech, because that's really driving so much of what we're doing, whether it's in life sciences or healthcare or health and wellness. So what do you see in the world of AI in terms of perhaps identifying patients in a preventative way? High risk patients are being identified for fall risk. Maybe
Yep.
we can use AI to identify patients, who have osteoporosis, for example, in a more accurate way, so as to kind of prepare
Yep.
in some way an educational world that we can create a better understanding, and that educational process promotes some of the things that you're trying to do. The world of osteoporosis, it's not necessarily kind of a trendy disease. At the moment, it was about 15 years ago, but it is a very, very pronounced, I would say, ubiquitous problem across healthcare, particularly for women.
Hmm.
And so I would be looking at different use cases in different disease categories in a forward-looking way, in a preventative way. Is there a
Hmm.
role for any of this as supportive devices? You talked about splints, for example. Is there a role, for example, for someone who has osteoporosis who wants to do, strenuous activity, unusual weight training, or something, that there can be some type of support system like people use for bracing their knees or other joints?
Yeah. And that's the really cool thing about custom immobilization devices, because you can make them as you need them. So if they need to cover certain areas specifically for that patient, this is patient specific medicine. So if they need support in a certain area specifically, you customize it exactly for what they need, the thickness, the coverage area, the exposures, all of those things. But
Right.
AI is so important in also healing outcomes, because when you turn an analog process where you don't collect data from it on an ongoing basis to a digital process where
Right.
now you're collecting for every single patient positioning information connected to a diagnosis with what they were prescribed, and then what their healing outcomes were. Now you have real data that you can use to improve healing outcomes and improve treatment. So
Right.
with this kind of design, a digital design process, when someone puts in a diagnosis, you can offer templates. They don't have to follow them. Of course, every doctor will still have autonomy to choose what they want for that patient. But
Right.
with the casting staff and the turnover there, I mean, when you have ortho techs and casting techs that, are being trained, and then you have turnover, and by the time you train someone, say, hey, this is specifically how I want these patients to be positioned for this injury, and have it be consistent for those positive healing outcomes, you're going to have that training, and everything is also an issue. So once you have, standardized templates and healing outcomes associated with those templates, you can use those as a training aid to reduce human error, and to improve healing outcomes, and to even bring new ideas in treatments to the entire global community once they, from the top down. Because you can say, like, hey, here's what, the NFL team physician prescribed for this player, and now someone in a primary care doctor in rural Indiana can also have that same data and information right in front of them immediately. And that's super helpful, that when you turn an analog process into a digital one.
Oh, terrific. I
Mhm.
want to take a moment just to circle back to the people who are joining us today. It's really fantastic. I want to thank Mustafa for joining in here. Um, Chad from Dallas. Mustafa is from Turkey. Nikhil from Canada. Um, Martin is from Norway. Jimena is from Brazil. Rashmi from San Francisco. Hello, Jenny from New York. Um, it's really a tribute to people who are calling in from all over the world, that there is a community that recognizes the importance of this amazing phenomenon, integrating science and medicine and technology into solving real life human problems. And I am very fortunate to be able to work with people like yourself, Diana, who um, are doing something that few people really understand how difficult it is to really take a vision, to move it forward, to be persistent every single day, year on year. It takes a lot of fortitude. So really Thank you for driving this forward, and thank you for thinking about how this is going to impact the healthcare system. At Endeavor, we are mission driven, so we want to support early stage companies. We feel from our research that the accelerator programs, and I'm part of many of them at Mass Challenge and TechStars, Matter Health, which are prominent organizations focusing on healthcare and accelerating early stage companies, they have a tremendously important role. But there's also a gap, and that gap happens after the 2 or 3 or 4 months when you're at an accelerator. And so the venture studio really looks at companies like yours that are more mature, that have gone through the hills and valleys of growing, have survived. Um, 90% of the companies that come out of accelerators fail within 3 to 4 years. Since 2016, there's been 700 venture studios created. Only 9% of the companies have failed. So I want to use this last bit of time to really talk about, in the most optimistic way, people like yourself. I want to encourage entrepreneurs out there, particularly women CEOs and CEOs from diverse backgrounds, to please contact us. Please let us know if you'd like to participate in the webinars. And please, send us information as potential investors or collaboration partners, because we want to do everything at Endeavor to support what you're doing. Thank you so much, Deanna, for everything that you have done. I don't know if you have any final thoughts or comments to the people out there, but please feel free.
Yeah, I would definitely just say if it's mission based, that's what will sustain you through that time. When others fail, if you are in it for the right reasons and that you're really able to make a change in the industry, you'll be successful. And I'm hanging in there until, and what's the definition, right? Every single morning I get to wake up and help people. So I'm successful now.
I could not agree with you more. Thank you, everyone, for tuning in to another Better Health webinar. Stay tuned for more to come. We have some incredible companies lined up over the next several weeks. We are not taking a summertime break, so feel free to tune in every Tuesday at noon. We'll be sending out more invitations this week. Dan, if you can hang on, I just want to say so long to everybody. Until next Tuesday, everybody, enjoy the rest of the day.